And this is all new video this morning of Dr. Oz rolling up his sleeve for the COVID-19 vaccine. You see him getting the shot there, and Dr. Oz is joining us live now to talk more about this and other coronavirus-related information. Dr. Oz, good morning. It's good to see you.
Good to see you as well. You know, it's partly our conversation yesterday that got me thinking I should get my vaccine and get out of the way, because there are people who are waiting. And if we all sort of get in the line and get our shots and get out of the way, then we'll be able to get through this process more rapidly.
Dr. Oz, how are you feeling after that shot? This was your first shot, right?
My first shot, the people getting their second shot just started today as well. So I'm at the end of the first cohort. It's a little sore, but not much. Didn't have a fever, no major issues. And I've had people on my show who've had the vaccine also report almost no symptoms. The second shot gives you a little bit of a low-grade fever. But we should talk about the second shot, because one of the big issues that's raging right now in the scientific community, and now the FDA issued a stern warning overnight about whether or not we need the second shot. And listen, the first shot is really effective and gets us a lot of the benefits. So some have said, in order to get everybody vaccinated more rapidly, maybe we can delay the second shot. The FDA is saying, hold on, Tiger, we don't know what happens if you don't give the second shot. It's possible, though, although it might work, it might not work. So I take a risk and gamble with hundreds of millions of American lives. So that's the debate that's going on. But we definitely have not done well enough as a nation vaccinating. Florida's doing better than most because Florida has a very strict rule. If you're over 65, get in line.
Yeah.
In many states, you've got so many rules you can't figure out where you are, and only 4 states in the country have given out more than half their available vaccines. So most of the vaccines are staying in warehouses still.
You know, Dr. Oz, I do want to touch on this because you kind of mentioned it. Let's talk a little bit about what we've heard about folks perhaps getting a half dose of that first shot instead of a full dose of that first shot. The FDA is saying that might not be such a great idea, but that is what some state governments are considering. What's your thought on that?
Well, it's not just state government. Scientists, people involved in creating these vaccines, are saying the data would show that maybe we can use a lower dose, or, as I pointed out earlier, a delayed second dose, both of which would allow us to get to more Americans. And we don't have data that can guarantee that's the right way to go, but whatever bit of information we have is supportive of it. And so this is going to be an important discussion. Now, we can avoid it all if we can just get enough vaccines out there more rapidly and get everyone covered. Then it doesn't matter anymore. Then we can do it exactly the way the clinical trials were done. And there's a risk if you change clinical trials, because you don't really know what happens if you don't give a second vaccine at 21 days out, which is the one in my case, or 28 days for the Moderna vaccine. But local health officials are frustrated. We don't have, if we had enough vaccine, we just say, forget about rules, just get in line, and over the next month or two, we'd vaccinate everybody.
You know, Dr. Oz, I know on today's show that you spoke with Surgeon General Dr. Jerome Adams for clarification on many of these issues surrounding the vaccine. What did you learn from that conversation?
There are a lot of very earnest, well-meaning people at the federal level who don't appreciate the challenges of actually getting into the trench and delivering the medications, the vaccine at the local level, and especially with the cold storage. And because we don't have large administration centers, large pharmacies involved yet, it's going to be slow. I think we should let the private sector get involved in a big way. If we turned every pharmacy into an administration center and told all Americans, look in your driver's license, if you're over this age, go there now, we get everyone done. Right now, the average viewer of the show has no idea when they're going to get vaccinated, and we should be able to do better than that. Yeah,
my mother-in-law included. She's 77 years old and has been frantically trying. So let's hope that we can get this moving smoothly for those folks, especially over the age of 65, 75. Dr. Oz, looking forward to your show today, as always. Thanks so much for joining us this morning.
Yeah, take care. Stay well.
All right, Dr. Oz, thank you so much. We do want to remind you, you can watch the Dr. Oz show. It's weekdays at 2 p.m., and it is right here on Fox 35.